안녕하십니까. 온라인 서저리의 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won of Online Surgery. Today I'm going to look at surgical clip and have a discussion with you. The patient of the day is 63-year-old female patient. At the time of the first visit, the patient had a little bit of hypertension and was taking anti-thrombotic agent. She was also taking medication for hyperlipidemia. In the case of anti-thrombotic agent, the patient was taking aspirin and clopidogrel. We talked with the internal medicine and decided to stop clopidogrel intake for 5 days, and aspirin was to be maintained. When the patient came in, the patient expressed pain in the lower left area and severe mobility. The patient received implant treatment in the past, but she still had fear in dental treatment, so she had a lot of reservations. The treatment plan, as you can see, number 37 is not in good condition and number 38 served no purpose, and therefore number 37 and 38 were to be extracted. Implant was to be placed in number 37, and there was a lot of alveolar bone destruction, and if necessary, bone graft was to be done. In number 35, there's apical lesion. Endodontic treatment was to be provided. This is after 1 week after extraction. In number 37, bone defect can be observed after 2 months. We're looking at how it is healing in the extraction site. This is 4 months later. It has healed somewhat, as mentioned earlier. Number 35, endodontic treatment was done. Through root canal treatment, canal filling has been done. This is after 4 months. After taking CT, you can see that the extraction socket is not fully healed. The distance with the inferior alveolar nerve is approximately 10 millimeters. The extraction socket is not really fully healed, so it's positioned quite deeply. 8.5 millimeter was planned. We decided to use OneGuide to place the implant. If you look at the CT, the extraction socket is not fully healed. OneGuide surgery report is displayed. If you look at the position, the distance with the inferior alveolar nerve is sufficient. K is 5.0 by 8.5 millimeter implant was planned. I believe good primary stability will be achieved if the implant is placed in the host bone rather than the defect in the extraction socket. I anticipated that there may be a little bit of bone graft necessary here. OneGuide drill will be used to do initial drilling. Diameter 3.5 and 5.0 drilling will be done. This was the treatment plan. We decided to place it slightly deeper. This is immediate post-op image. KS3 BA surface of 5.0 by 8.5 millimeter implant was placed using OneGuide. It has been placed in the desired position. At the time of placement, ISQ was about 78. The stability was good and the bone was not fully healed. A Oss was used to do bone graft. This is a CT image of immediate post-op. On the superior part of the implant and distal area, bone graft has been done. Membrane was not used. This is after 2 months. ER-type prosthesis was connected. This is taken in March, so it's been approximately 5 months later since surgery. In the distal area of the extraction socket, A Oss was used and bone graft was done. On panoramic image, it has healed nicely. A lot of alveolar bone defect has been healed. You can see that healing is done nicely. Let's look at the surgical clip. OneGuide template is adapted to make sure it's fixed. I'm using a mirror to check whether it's positioned properly. I'm checking the fit with neighboring teeth as well. As mentioned, we're going to do bone graft, so flap elevation is done. On the distal side of the planned position, vertical releasing incision is made to elevate the flap. Incision is made. I'm not going to reflect the flap fully. I'm just going to reflect it so that it does not get in the way of implant placement. OneGuide template is positioned once again. Initial drill, wide type. This has a gold rim. Now drilling is done. So flattening drill is not used because there's not a lot of bone. Initial drilling is done. I was worried about the drill slipping because it's an extraction socket. I'm using 10mm path drill because it's an extraction socket. I'm using this on the mesial wall to prevent slipping. 3.5 by 8.5 OneGuide drill is used for drilling. Depth gauge is used to check whether the surgery is going smoothly. 5.0 by 8.5 OneGuide drill is used for drilling. Implant needs to be fixed on the apex area. Drilling is done sufficiently. KS3BA 5.0 by 8.5mm implant is going to be placed here. Implant is being placed. The implant driver and torque wrench is used to get the final position. I'm making sure that the template does not move here. Primary stability is over 30 Newton centimeter. The implant, as shown, depth is checked using the slot. Template is removed. Smart peg is connected to measure the ISQ value. ISQ value is about 78, so it's quite favorable. Because it's extraction socket, there's no bone on the superior side, but it's okay. Cover screw is connected. We reflect the flap a little bit further, and on the extraction socket, I use A Oss, which is a bovine bone. Bone graft is being done in this way. On the extraction socket. In the superior side and the distal area, bone graft is done. At times you can use membrane, but in this case I did not use it. If you use membrane, you can get better result, but the defect was not very severe, so I went without it. Today's surgery was comparatively simple. I placed the implant in an extraction socket which is not fully healed. I used a hydrophilic BA surface implant which has been released from osteo. I used a OneGuide to place it in the desired position on the distal side because there was bony defect. Although I used OneGuide, I made a small incision to do bone graft with bovine bone and A Oss. As shown in the final panoramic image, 5 months after surgery, the final prosthesis has been delivered and it is healing nicely. Thank you for watching.